Alright everyone, in this video we are going to talk about Cpap. Cpap stands for Continuous Positive Airway Pressure. So when you think to yourself, I've heard of positive pressure before. We've talked about it when we talk about BVM ventilations. BVM ventilations deliver positive pressure when you squeeze the bag. Cpap delivers positive pressure continuously, both on the patient's inhale and on the patient's exhale. That's important because what we're trying to accomplish with Cpap is we're trying to deliver PEEP to the patient, positive end expiratory pressure. So that gives your patient pressure to breathe out against. So this is important because we're trying to use that pressure to splint their airways open so that when they breathe out, those airways can't collapse. We force them to stay open, thus making it easier for them to breathe. So we can use Cpap on asthma patients, COPD patients, and CHF patients who are awake, alert, breathing on their own, and maintaining their own airway. The breathing on their own is important because this just forces air in. It doesn't actually provide ventilation at all. It just gives them positive pressure all the time. So they need to be taking their own breaths for this to work. They need to be awake and alert so that way they can work with it and not fight against it. They need to be maintaining their own airway, otherwise this constant rushing air is going to take anything in their oral pharynx and deliver it right down into their lungs, which can give them an infection. You also cannot use this on any patient who you suspect has a pneumothorax, because that pressure is just going to cause that pneumothorax to progress rapidly. You cannot use this on any patient who is vomiting, because once again, we're just going to force that vomit right down into their lungs. Your patient must have a systolic blood pressure greater than 90. Because of this pressure that we're putting in there, it can reduce preload to the heart. When you reduce preload, you reduce blood pressure. If we reduce their blood pressure too much, obviously they're probably going to go unresponsive, and we don't want that. So like I said, Cpap is a great tool for your asthma, COPD, and CHF patients. Maybe you've been on scene for a bit, you're trying a non-rebreather, you've tried meds, and they're just not getting any better. But you can also use this, you just walk in and look at your patient and go, ooh, they look like they're having a really hard time breathing. You can go right to Cpap to try and improve them. So let's talk about setting up our Cpap, and then we will go into how to apply Cpap to our patient. So I have two different Cpaps here. I have an older style mask here, and then I have a newer style over here. So you'll notice both of these have a face mask. Inside of both face masks, we have a double layer seal here. So this needs to form a tight seal around your patient's face. We can't have any air escaping from it, otherwise it's not going to work as intended. So it's got double layer seal. They both have a headpiece attached to them. It's attached up at the top on the forehead, and then they connect down here underneath. It'll come underneath the ears to help hold that in place. Where these masks differ is in the tubing. So here's the old one's tubing. This comes with a flow guide, which we'll go over. On the new one, it looks much different. This one has a dial a PEEP, so you can set how much PEEP you want just by spinning this, where with the old one, it is set with how many liters of oxygen you are putting through the device. The other big difference with the new one is right here is a port that you can attach a nebulizer to. So for your asthma and COPD patients, you can actually give them a nebulized treatment along with the Cpap if your protocols allow it. Our masks do come in several different sizes. There is a small, medium, and then there is a large adult. So make sure you look at your patient's face to figure out which size mask is going to fit them. So I have assessed our patient and determined that a large adult mask would be the perfect size for him. So we are going to get this set up. So the first thing we're going to do is drop this all the way down, make sure it's ready. I want to give my patient a PEEP of 5. So on here, PEEP of 5 is 8 to 9 liters per minute of oxygen. So I'll get that hooked up to my oxygen source, which I'm not actually going to turn on because otherwise it'll wash out all the sound of the video. So let's turn the camera here so we can see our patient. There he is. Now, we're going to take our mask, and this just clicks right in there, just like so. Now, I would turn my flow setting up to whatever I wanted at, so I would turn it up to 8 or 9. So I'm just going to turn it on real quick so you guys can see. So as your patient breathes, you'll see that dial will move. It should go about to 5, which is the PEEP that we want to deliver. Now with our oxygen on, the first thing I'm going to do, I'm going to talk to my patient and be like, all right, sir, I'm going to put you on a device. It's called Cpap. What it does is it's going to blow air really hard into your face, and it's going to give you something to breathe out against to force your airways open, which is going to help you breathe better. It does feel really strange, so I'm just going to hold this up to your face for a minute so that you can get used to it. I just want you to breathe as normally as possible with the device. And I'm just going to take and just put it right on their face for a minute. Not going to smush it into their face, I'm just going to hold it against there so they can get used to that pressure against them as they're breathing. Once they're used to it, give them a minute or two. All right, so are you feeling comfortable with that? Is it okay? And if he says yes, it's helping, then we can start to work on securing this to our patient. My head strap is backwards. There we go. So I'm going to tuck this around behind his head here. These just clip on like so. I'm going to adjust the forehead piece so that it's snug against their forehead. And now we're just going to tighten this device down so that it's snug. You don't need to refit all the way down on their head. Just adjust both sides at the same time. Make it snug there. Same thing down here at the bottom part. Whoops. Don't try not to do that. And just make sure that it's nice and snug. Why are you not Velcroing? There we go. Now we're going to look and make sure that there's look and feel and listen, make sure that there's no leaks around the edges. We're going to look at our dial and make sure that it's going to our desired PEEP, which in this case I wanted to do a PEEP of 5. And now we're just going to monitor our patient. We're going to keep encouraging him to just take nice breaths and let the Cpap work. We'll monitor his pulse ox, his respiratory rate, make sure we monitor his blood pressure, make sure we don't drop his blood pressure down too low. The great thing about Cpap is it works pretty quickly. You will see a very quick turnaround. If it's going to help them, it usually starts helping them within a minute or two, and they'll start telling you, I'm feeling a lot better, I'm breathing a lot better. The important thing is once you start Cpap, unless your patient stops breathing, goes unresponsive, don't take the Cpap off because it can quickly reverse back to how they were. So once it's on, call the hospital, let them know that you have a patient who's on Cpap. That way, when you get there, hopefully respiratory will meet you in the room and they can switch to their device. All right, that is Cpap.